Chapter 23. Keeping your baby well. A baby grows fast, almost too fast, for at times you will feel you would like to have him small a little longer. But each week there will be something new as he learns to do new things. Playing is very important, for this how he learns to use his hands and feet. Let him move as freely as he can. Do not restrict him unnecessarily. To keep your baby well, be sure that he is always clean and well cared for. A clean baby is more likely to be healthy and happy. If other children want to hold your baby or play with him, be sure their hands are clean and that the children themselves are free from colds and other infections. Germs can be dangerous, but with reasonable care, your baby can be protected and enabled to build up a good resistance against disease. Bath time. Your baby's bath time should be one of the happiest hours of the day for him and also for you. This is the time when he learns clean habits that will stay with him throughout life. The best time for bathing him is just before his mid-morning feeding. Clean and relaxed, he will then enjoy his food more. Be sure to have everything ready before you begin. The room should be warm and free from drafts. You will need a low table, a chair, a pan of warm water, a cake of mild soap, a soft washcloth, a large bath towel to cover him, and a small one with which to dry him. Fill the pan about half full of warm water. Test the temperature with your elbow to be sure it is comfortable. Now gently wash the baby, taking care not to scratch his skin with your fingernails. Do not allow soap suds to get into his mouth, nose, or eyes. Handle him carefully, for a wet baby can be slippery. After cleaning him thoroughly, let him kick and splash for a few minutes to develop his muscles. As he grows older he can remain longer in the tub, for this is something he will enjoy. But never leave. 180. Keeping your baby well. Him alone in the tub. He could slip under the water and drown. After bathing him, lift him carefully and dry his skin with a soft towel. Be careful not to twist or jerk his arms or legs. You should never lift a child by only one arm. Small children's arms are not strong and putting all their weight on one of their arms may so strain the ligaments and nerves as to damage them seriously. Always pick small children up with a two-handled grip. Dress him suitably, according to the season. His clothes should be loose enough so he has room to kick and squirm and develop strong muscles. Thumb sucking. Don't be too concerned if he wants to suck his thumb. This is one way of satisfying his hunger and giving him a feeling of comfort and well-being. Some adults chew gum for the same reason. If he sucks his thumb a lot, it may be time to increase his food, or perhaps give him a suitable toy. In any case, don't worry too much about thumb sucking. This is normal, and usually quite harmless. He will probably soon grow out of it. Constipation. Breastfed babies rarely are constipated. Babies on formula may have more difficulty. Perhaps they are not receiving enough liquid in their diet. If the stools are hard, just give the baby more boiled water and add a teaspoon of honey or sweetening to it. For severe constipation, try a glycerin suppository inserted into the anus, although this is not a good habit to start. Many older people are troubled with constipation because of improper laxative habits that were developed during their early years. Try to be patient and avoid tension in the home as much as possible. If you allow enough time, nature will usually take care of the constipation problem. But there are times when you may have to give the baby an enema. This is how to do it. Secure a small rubber syringe with a soft tip. Wash it thoroughly, then fill the syringe with warm water. Add a little lubricant, such as Vaseline, to the tip, and gently insert into the baby's rectum. Squeeze very carefully, allowing the water to fill the rectum. Then remove the syringe. If only water comes. Diarrhea and vomiting. 181. Out, repeat the treatment in about 20 minutes. If there is any blood in the stool, report this at once to the doctor. As far as possible, avoid giving enemas. Diarrhea. 1 or 2 loose. Watery stools may not be significant. They are rather frequent during the earlier weeks and months of life. But if they come too often, you should consult your doctor. If your baby has a bad case of diarrhea, this is no time for simple home remedies. Large, loose stools may drain much of the essential water from the baby's system. Such fluids must be replaced as soon as possible. Diarrhea is really not a disease in itself. It is a disorder that may arise from many different causes. It is most frequently due to contaminated food. Be sure the baby's bottles and utensils are scrupulously clean and sterilized before you use them. If you are breastfeeding the baby, you may be taking too much laxative yourself. Some of this finds its way into the milk, causing trouble for the baby. Whatever the cause of the diarrhea, omit several ordinary feedings and give just boiled water with a little honey or other sweetening. Then gradually return to the regular dietary program. If the baby seems ill, take him to the doctor without delay. Vomiting. An occasional spell of vomiting is nothing to be alarmed at. It may be due to overvigorous handling of the baby. But persistent vomiting can be serious. It quickly results in severe dehydration. A young baby cannot afford to lose all those important body fluids. Vomiting may arise from many different conditions. Among the more serious are certain malformations of the digestive organs, or perhaps an injury to the skull during birth. But these are very rare. A far more common cause of vomiting arises from the baby's swallowing air and not being able to bring it up again. Sometimes the clothing may be too tight around the abdomen. Vomiting may also be the first sign of some acute infection in the digestive tract or elsewhere in the body. In any case, contact your doctor without delay, especially if the baby has a fever. He just cannot afford to lose much fluid. 182. Keeping your baby well. Taking baby's temperature. Every mother should know how to use a rectal thermometer. This is how it is done. First, wash the thermometer in cool water. Hold it carefully and shake the mercury down into the bulb. Then apply a little Vaseline or other lubricant to the bulb end and gently insert the thermometer about 1 inch into the baby's rectum. Hold it there for at least 3 minutes. Remove it and wipe it off with a piece of soft paper or cloth. You can then read the baby's temperature by noting how high the mercury rises in the tube. Normal body temperature in the rectum is 99.6 degrees Fahrenheit or 37.3 degrees centigrade. If it is about 1 degree above the line marked as normal on your thermometer, you need not worry too much. Just take the baby's temperature again in 1 hour. If the temperature rises over 100 degrees F, take the baby to your doctor. After using the thermometer, carefully wash it with soap and cool water, putting it in a safe place for future use. Always note down the temperature, particularly if it is above normal. If the baby seems ill, take the temperature at least every 4 hours. When baby has a cold. Colds are caused by viruses which open the way for other germs to enter the body. Most colds start in the head or throat, and later involve the bronchial tubes and lungs. Usually the first symptom is a runny nose and perhaps a bout of sneezing. Treatment: keep the baby in a warm, comfortable room with fresh, warm air day and night. Don't worry too much about his diet for the present. Just be sure he gets plenty of boiled water, preferably lukewarm. Give him plenty of fluids and fruit juices. Keep his nose clean, and keep visitors away from him as much as possible. If the cold does not clear up in a few days, take him to your doctor. Ear trouble. Ear trouble often follows a bad cold. Sometimes the child will refuse to eat and may pull at his ear. This means real trouble. Never neglect a bad ear. You must seek good medical advice without delay. Croup and convulsions. 183. Many cases of deafness in later life can be traced to ear infections during the early years. Most doctors use antibiotics and nose drops to relieve the congestion and clear up the infection. If the child still complains of earache, take him to your doctor. Don't delay in seeking medical help, and don't wait until the middle of the night before doing something. Delay can be dangerous, especially with head colds that are complicated by earache. While waiting to see the doctor, apply a warm water bottle, well covered, to the painful ear for several hours at a time. Another time-honored remedy is to heat up a small bag of salt, cover it with several thicknesses of cotton or wool, and apply to the ear. Croup. If the child's breathing becomes difficult, and he seems to be struggling to get his breath, you must do something at once to relieve him. Most doctors advise the use of warm, moist air to restore the normal humidity of the room. Boil a pan of water on a hot plate or primus in a corner of the room, adding a few drops of eucalyptus or menthol. This will moisten the air and help the child to breathe more readily. Even an old teapot or kettle can be used to provide steam inhalation, as suggested on page 91. Don't leave the baby by himself during the treatment. Be sure some responsible person is there to watch him. Young children are easily injured. As soon as the treatment is over, change him into warm dry clothing. Convulsions. Nothing is more frightening to any parent than seeing his child have a serious convulsion. The attack is usually very dramatic, but lasts only a few seconds. The baby's eyes roll upward and the baby twitches violently. Most convulsions in young children are related to some infection in the nose and throat, or perhaps the onset of some more generalized childhood infection. Here is what to do. Call your doctor at once. While he is coming, place the baby in bed, face down, to allow the secretions to drain from the mouth. Cover his body with a cool wet towel and place a small ice bag on the head. F13. 184 Keeping your baby well. Take the temperature rectally but not when the child is actually having a convulsion. Save any stool specimen for the doctor to see. Draw the blinds and keep the child quiet. If he has high fever, sponge him with tepid water. When a child has convulsions but no fever, the trouble may be due to some form of epilepsy. Take the child to your family doctor for further diagnosis and treatment, as suggested in Chapter 45. Skin trouble 185. Fortunately, babies rarely die from convulsion, but they should always be given proper medical care without delay. Skin trouble. Clean skin has great powers of resistance to germs. But an irritated skin is often a cause for real trouble in the young child. Chafing of the skin is more likely to occur where two moist areas meet, such as in the groins or buttocks, or under the arms. Skin reactions are more common today because of the many new fabrics in use. Babies often develop skin rashes because of irritation from the coloring materials in these fabrics. Water-repellent chemicals in materials are often quite dangerous to those with skin allergies. It is wise to wash each new item before you allow your baby to wear it next to the skin. If a rash occurs after the baby has worn some new article of clothing, be sure to wash it several times before using it again. If it still causes a rash, discard the article completely. Bland soap and soft water are best for laundering baby clothes. Strong detergents may cause trouble in the skin. Diaper rash usually arises from some chemical irritation due to certain germs that are present in the baby's stool. These germs break down the urea into ammonia, which burns the skin. Treatment: boil the diapers to kill the bacteria. Then rinse the diapers at least 4 times in soft, clean water, and dry them in the sun. As for the baby, keep its skin clean and dry. It is well to apply some mild zinc oxide ointment to any sore spot once or twice daily. Be careful about using powders on the skin, some of them contain zinc stearate, which is particularly dangerous to babies. As your baby grows. When baby is able to sit and crawl, he should have a playpen, or some special corner of his own, with toys suitable to his age. Be sure there are no sharp points on these toys, or any loose objects, such as buttons, that might be pulled off and swallowed. Lead paint is highly poisonous to children. Unpainted or plastic toys are always safer for young children, who always tend to put things in their mouths. 186 Keeping your baby well. Companionship. As your child grows older, he will need the companionship of other children. After all, he must learn to get along with other people. Adults can never fully take the place of children in the life of a child. So be sure he has plenty of children to play with. However, be very careful not to foster feelings of jealousy among your children. Give them each an equal share of your love and interest. Family favoritism is not fair. It always brings unhappy results for all concerned. Regular sleep is also important to health. Be sure the bed is warm and comfortable, with plenty of fresh air circulating in the room. A young child will usually sleep better without a pillow. The bed covers should be light and adequately warm. His night clothes should be made of cotton, for wool may irritate the skin and keep him awake. At bedtime, a child should be put to sleep in his own bed. Spend a little time with him every evening, talking and singing to him. Even though he may not understand all your words, he will appreciate the tones of your voice. Listening to his mother's good night song will become one of the loveliest memories that he will carry throughout his life. Toilet training. Babies are wonderful to have around, but they always bring certain problems and responsibilities, particularly regarding toilet training. Every mother naturally looks forward to the time when her child will care for his own bowels and bladder. What a joy to be free of that burden. But do not attempt toilet training too soon. Proper control of the bladder and bowel is usually not attained until the child is in his second or even third year. Toilet training is one thing you should never try to hurry. If you are impatient with him, there is bound to be trouble, not only now, but perhaps later in life. Don't scold the child or become restless. Just give him time to function normally, if he can. And when he does succeed in pleasing you, be sure to compliment him. All young children appreciate compliments. Bedwetting 187. Let me add a word of caution. Never use suppositories or enemas unless your doctor so orders. These things have no place in the normal training of a young child. As far as possible, avoid all laxatives, for they may ruin the normal habits of your child. A little patience now may save you and your child many nervous problems later on. Toilet training should be a happy time, but the child must understand what is required of him. If he has soiled himself, just clean him up without making any comments. These accidents are always more likely to occur when the child is tense, or when he is excited because of visitors. Naturally, this is the time when you want him to be on his best behavior. Be careful not to have him upset at such times. Keep him calm, and he will learn to take care of himself much sooner. Remember, there is nothing easy about growing up. There are so many new things for every child to learn. Be kind and patient with him, and he will give you the full measure of his love and devotion as long as he lives. Bedwetting. By the time a child reaches the age of 2, he can usually keep himself dry during the day. However, it may be another year or more before he can keep dry all through the night. Even then, the best trained child may fail to live up to expectations on certain occasions when he is highly excited. Bedwetting accidents are common during the early years. A wise mother will not shame a child or punish him. She will just change him without comment. The accident itself is punishment enough. Just treat him sensibly, and he may soon learn to take care of himself. Older boys and girls may also have occasional problems at night, especially when sleeping in a strange bed after a highly exciting evening. Don't make the child feel guilty. This may cause him to lose confidence in himself and rob him of his self-respect. Just be sure he has plenty of sleep and rest and a pleasant home environment. Here are several suggestions to help overcome bedwetting. 1. Reduce the amount of fluid just before the child goes to bed. Don't be unreasonable, especially on a hot night, for the more concentrated urine may be irritating the child and causing him to lose control of his bladder during sleep. 188. Keeping your baby well. 2. Don't be overanxious about this problem. Making an issue of it may only prolong the problem. Try to keep the child relaxed, even if he is a little slow in outgrowing this habit. 3. Take him to the toilet before you go to bed yourself, especially if this is a frequent problem. 4. Be sure to reward him in some suitable manner when he succeeds in keeping dry at night. Do not punish him when he fails, but when he succeeds give him some special privilege which he values highly. 5. Give your child a happy home of which he can be truly proud. Try to remove all friction within the family. This may help to solve not only the bedwetting but all other nervous problems as well. Vaccinating your child. Years ago millions of babies died every year from such serious diseases as smallpox, polio, diphtheria, whooping cough, and tetanus. Today all of these conditions can be prevented, thanks to immunization. Vaccination offers protection against smallpox. The baby should be vaccinated for smallpox at 1 month of age. If the mother has not been vaccinated, if she has been, the baby may be vaccinated at 3 months of age. A combination injection known as DPT polio is available for protection against diphtheria, pertussis, whooping cough, tetanus, and polio. Other serious disease such as typhoid, typhus, and yellow fever can also be prevented by periodic inoculations. Here is the time schedule for these preventive shots. First DPT polio shot - 2 or 3 months of age. Second DPT polio shot - 1 month later. Third DPT polio shot - 1 month after the second. Booster DPT polio shot - at 18 months of age, and repeated at 5 years or just before beginning school. Oral polio vaccine - use this in the dosage recommended by your public health officials. Smallpox vaccination - at 3 months of age and repeat every 3 years till adult life. Vaccinations 189. Typhoid paratyphoid - vaccination should be given to all children after age of 1 year in areas where these diseases are prevalent, with booster shots annually or when traveling to distant places. Cholera inoculated after age of 1 year. Booster every 6 months. Typhus, yellow fever vaccinations are advisable wherever these diseases are prevalent. Follow the directions of your local public health authority.